Dr. Vikki Petersen here. A reader writes in that it took over 10 years for her to be diagnosed with celiac disease. She said she felt that she was close to death. She was wasting away to almost nothing before her diagnosis occurred. And upon that occurring, she has been very good about staying off gluten, and she exercises and takes her supplements as recommended. Her problem is a very enlarged abdomen, and she's apparently quite in tone everywhere else, but this abdomen is a source of not only embarrassment but a source of concern, because she knows it's not healthy to carry weight in the abdominal area, and she's correct. So she wants to know what she can do about this. I'm not sure the timing as far as how long she has been off gluten. That wasn't mentioned, and so there's a couple of things that I recommend that one look into in this kind of case. The first one is that she does mention it took 10 years to even get a diagnosis. That's when she started feeling poorly, and that she was absolutely emaciated and wasting away to nothing by the time that diagnosis occurred. So, of course, with that severe a case, there was probably complete annihilation of the villi of the small intestine. Absorption was next to nothing, and she literally was starving to death at that point. There are patients that when they first start absorbing again, so they've removed the gluten and healing is starting to occur, almost like a cut or a tissue that's very irritated, the body will hold fluid just as a cushion to kind of make it easier for the healing to occur, and just as a bit of a buffer to the system. And sometimes you notice that if you have a deep cut and then there's swelling, and so it's part of the immune system response. And if you imagine your small intestine, which is 23 feet in length, it has the surface area of a tennis court, and when that happens to a structure that large, of course, there's sort of nowhere else for it to go but outward. So it could be a temporary response just to the small intestine starting to heal itself after all these years of abrasion and irritation from gluten. So it might very well be a temporary response, and in that case, fine. If it's not, if she's been off gluten for more than several months and this is persisting, then what I would look at is, despite the fact that she says she's being very good on her diet, and I'm sure she is endeavoring to be, just to triple check and make sure that there is no gluten coming in by way of something she's unaware of. That's always the first place to check. And then secondary to that, we talk frequently about secondary infections happening. Very, very common with celiac, very common with gluten sensitivity, and it only makes sense. 70 to 80% of your immune system is housed in your small intestine. A patient with celiac, by the time they're diagnosed once again, that immune system has gotten very worn down. It becomes a bit of a happy home to organisms who would otherwise not be allowed entry into the small intestine, such as parasites, amoebas, bacteria, and the like. So doing a stool test on this patient to ensure that there's no inhospitable organisms present in her small intestine would be a very smart thing to do. Once that has been decided, yay or nay, then I would also look at prescribing probiotics, making sure all those good bacteria are back in the small intestine to help restore the balance of the immune system, and also such things as glutamine, which is an amino acid which can help heal the tissues. Also, she does mention that she's trying to be very diligent about supplements. I'm assuming that includes things like vitamin B12 and vitamin D and some other minerals, perhaps like zinc and calcium, that are known to be deficient in a celiac. So she's taking all those, and she's taking them in an absorbable form. That would be another thing that I would ensure was part of the program. So these are the areas that I would look at. It's definitely not normal for that to happen. If it's temporary, it's okay. If it's chronic and it's not abating, that means there's another stressor to that small intestine that's causing this swelling and distension, and we need to identify what that stressor is so that she gets a small intestine that actually does what it's supposed to do, which is to turn the food that one is ingesting into fuel, because if your small intestine is not doing that job, there's no way that you can be optimally healthy again, because you're not feeding your cells. So I hope this was helpful, and until next time, to your very good health.